All new this morning, it is Suicide Prevention Month. And with students now back in school, mental health for children and young people, it's top of mind. Suicide is now a leading cause of death among young people, and many families aren't sure how to talk about it. Joining us this morning is Dr. Carmen López-Arvizu, a psychiatrist and director of outpatient psychiatric services at the Kennedy Krieger Institute. Good morning to you. Thanks for joining us.
Good morning.
Let's talk about it right here. Suicide, now one of the leading causes of death among young people. Why are we seeing this?
So we have always seen this. I think, however, in the latest time, there's more information about it and there's more announcements of the things that happen, but it has always been present. We have never brought it to the surface and have it in conversation within our families until now.
So many parents say, I just don't even know how to bring this up. I've spoken with parents who have sadly lost children this way, had no idea what was going on. So what's a safe, healthy way to start this conversation?
I think the first line is to think of this is something that can happen to anyone. This is something that we need to be open and talk about. Mental health has had so much stigma through our years. We see it all the time in the media and in conversations and in jokes. It is important that we give it the importance and the relevance that it needs. You need to address it to be able to prevent long life effects of mental health, but also death.
You know, my youngest child is about to turn 21 next week. I've had teenagers. They can be moody. How do we know when to differentiate between something more serious and just what, we know the teenagers go through?
Yes, open communication with your children, it's important. You need to understand how they are in the usual life, and so you are able to notice any kind of changes in their mood. You see irritability, withdrawal, maybe socializing less, grades going down, changes in behavior that are not your typical. And if you see that, you need to bring it up. You need to bring this conversation to the forefront and have it with your teenager.
Okay, so now we see the signs of struggle, we see the grades, we see the moodiness. What in the world do we do next?
Well, the first thing, as I said, is conversation with your youth and ask the questions. I think we are afraid of saying the word, but just because we don't say it doesn't mean it's going to go away. So we have to ask if they have any thoughts of dying or death or planning, or have they talked about it with anybody else. And then you have to find some support around you with your immediate, your primary care, your clergy, your, counseling at school, things that people that surround you closer to look for the more immediate support. And of course, there's always the emergency line 988. If you at any moment have very important concerns about this, do not hesitate. Call 988, ask for support, and you can also get some more information on resources. Now, the other thing is that there's an emergency room, so do not doubt this is life or death situation. So it is very important that it's addressed.
Take action. Okay, thank you so much. That's our time today, but really appreciate you joining us for this important suicide prevention month, and hopefully we'll start to see some of those numbers go down, especially for our young people.